So Leela's gonna
Welcome.
kick us off before we
Yes,
start
yes,
playing. Do a little intro.
yes. Thank you everybody for joining us tonight for the Price is Right Healthcare Edition. But first, I'd like to say a few words about the Right Care Alliance. Right Care is a grassroots coalition of clinicians, patients, and community members organizing to make healthcare institutions accountable to their communities and put patients and not profits at the heart of healthcare. Right Care's vision is of a transformed system in which the pursuit of health is a right and healthcare is based on healing relationships, close to home, affordable, effective, and just. We all deserve a system in which health professionals and patients alike experience the care they give and receive as necessary and meaningful. Right Care Alliance's current campaign is focused on confronting the enormous problem of medical debt. 1 in 10 adults in the US have medical debt. To begin the process of learning about medical debt, on March 21st of this year, Right Care held a Zoom meeting entitled Researchathon, which introduced the participants to several online websites. In particular, and I highly recommend looking at this, Turquoise Health. These websites can be used to research the cost of diagnostic tests and services at hospitals and medical centers, and as well provide examples of how hospitals handle patient medical debt and how people cope with medical debt. Tonight, everyone is invited to estimate the prices hospitals and medical centers charge for a variety of diagnostic tests and services. Hence, the title of our meeting, The Price is Right Healthcare Edition. Playing the game will illustrate that the prices of services and diagnostic tests are often strikingly different from one institution to another, thereby greatly affecting medical debt outcomes. To Matt.
Oh, thank you, Lou. So welcome to everybody. Really glad to be here. This is going to be fun, and it's going to be thought-provoking, and it's definitely going to be raising some interest and concerns about what's going on. My name is Matt Ryan. I'm a doctor of emergency medicine at the University of Florida. I'm a very proud and longstanding member of the RCA, and I think this is an incredibly important initiative. And I know, speaking to the choir, and Fred, I'm going off script a little bit, but that's what I do. But I know, speaking to the choir, but this is what we have to do to get other people to buy into the concerns. You know, 1 in 10 people have mounting medical bills, and that's a lot. And these are not insignificant bills. These are significant bills that people have to deal with, and it weighs on them every single day. So, you know, The Price is Right is a fun game. I remember watching it and growing up with my dad, and it was always about, like, you know, Dove detergent and stuff like that. But we're going to be talking about picking the costs of some healthcare bills, and I think we're going to be surprised this evening about how much these costs really, really are, and what people, regular people who are not affluent, have to pay moving through. You know, and nobody wants to have a healthcare issue or concern. Nobody wants that to happen to them. But when you get a bill, it could be astronomical, you know. And I remember personally, if I may, my oldest dumped his motorcycle, and the bill for that cost to go to the trauma center was ridiculous. And I felt personally, as a guy that works in an ER at a major trauma center, I felt a little ashamed what we do to people and how much we charge those. And I can weather that, but not everybody else can. So let's move forward. Let's have a good time. Let's have some provocative conversations, and let's see what we got. So I'm going to read the rules. Fred, you wrote these, correct? So I'm just going to read them verbatim, and I appreciate you doing that for me. All right, hold on. I'm going to open up a new window. I'm almost there. Okay. So The rules of the game are as follows, and they're simple. I'll leave a test or service, and the first 10 members of the audience who enter their estimate on the chat will be counted. The goal is to come as close to the right price as possible without going over. Remember, prices right rules are always in effect. Can't go over. Your goal is to come as close to the right price. Let's see how we do. On completion of estimating one service or one diagnostic test in 3 areas, and this is all going to be on the East Coast, we'll have the top 12 participants and a final estimate of common diagnostic tests. The winner will be estimated on declared overall winner and receive a grand prize, which unfortunately is our undying love and affection for you. We will ask the audience to estimate the charges. Let's start the service. Are you guys ready? All right, Betsy's ready. And I think everyone should just unmute their mics and be raucous, or don't. Okay, let's go. There you go.
Wait, you got to say, come on down. You're the next contestant.
Come on down. You're the next contestant. So I once gave a lecture to 400 people via Zoom. And it was one of the most painful lectures I've ever given. And I used to be a chemistry professor at Purdue, where I had that number of students in the lecture hall, and I could respond to their energy in all of those things. And not feeling that left me feeling hollow and alone. Don't do that to me. All right, here's the first question. What do you think the published cash charge for this service is? Oh, wait. Okay, let's start with the service that is usually non-voluntary, but the consequences of an unexpected illness or an injury, right? So that's an emergency medicine visit, unexpected. It's a level 3 charge, seriously ill, but may end up requiring hospitalization. We'll start with North Florida, the University of Florida, Shanty. Level 3 charge, unexpected. Could be anything. Well, Tyler, so if this is just a vanilla level 3 charge. So level 3s in an ED, we parse them is upright or vertical. Do you need a bed or do you need a chair? So going into the ED, you do not know. But the actual charge just for a level 3 straight up front is $387. I could use some help looking at the chat. Ooh.
Looks like Stuart.
Oh. Holy crap. Okay. No, I got some unpacking to do. I don't know if we get through all the scenarios.
I think Angela's closer.
Who said that?
It's like Angela might be closer.
Right. But let's talk about this somebody like Lena. You said $10,000. Lena Menendez, I'm calling you out. Or not. Could you hear me?
What's your question, Talina?
Well, why did she say $10,000? Okay. Elizabeth? $35,000? Okay. You know, it's not cynicism if it's the truth, but that's cynical. I'm just going to say that. And Angela, how did you come up with that answer?
Well, I used to work in a hospital, and so I kind of figured, well, that was a long time ago, but the charges went up since then. So I just kind of added a little bit more to it. That's all.
Yeah, you stuck the landing, right? Like a basic level 3 chart is perfect. And if you look at the numbers that people are saying in the chat, like for the most part, they're really expensive. Vanessa, 6,001. That's pretty funny. You are playing The Price is Right. Thank you so much for accepting the spirit of the challenge. All right, let's go to another scenario.
Who's the winner? Who is the winner?
Oh, Angela, clearly. Oh, but she went over, so there are
She
no
went over.
winners.
She went over.
He went over.
It's a tie. It's a tie between Stuart Fisk and Vikas Sana.
Well, I'll step down because that was my second one after I thought about my first one was in the thousands, and then I realized, oh, this is just the encounter. So
Yeah, which again is just to walk in the door, right? That's what we haven't done a CAT scan or anything. So yeah, no, it's tough, right? Okay. Next question. Now let's ask you to estimate the cost of the same service for healthcare of America at the HE Hospital in North Florida.
sorry,
So
I
we're
didn't
going
get
from
that.
Shands to North Florida. So we're going from a for-profit hospital, a public hospital, to a not-for-profit hospital. UF is a not-for-profit hospital. So now we're going to ask you what the same cost is for a level 3 visit. You know, belly pain.
We're getting some questions about what is a level 3 visit? What does that mean?
Sure.
What does that include?
Sure, Steph, I could answer that. So it's about triage. So triage is as follows. The lower the number, the quicker you're going to die. So a triage severity 1 is we're doing chest compressions, or you're having a stroke or a heart attack with massive ST elevations on your EKG, right? So you're in imminent doom. If you don't see a physician now, you're going to die. A level 2 is we got a little bit of time, but like maybe 10, 15 minutes, like a bad car accident where you might have a pneumothorax or something like that, right? And then we escalate up to this level 3, which is this ambiguity of triage severity. And the triage severity is how much resources we need to use in order to take care of you, right? So do you need me right now at the bedside? Or do I got a minute, to go get a biscotti and a muffin? So that's what a level 3 is. So, and then the level 3 is, are you vertical or you're horizontal? Like, are you coming in via EMS, right? So you're horizontal, or you walking in. And that would be like abdominal pain, stuff like that. I'm pregnant and I'm bleeding, and that's a level 3. A level 2 is I got a fever. Or no, level 4 is I got a fever. And a level 5 is the dog ate my homework. Does it make sense? So that's a huge stratification. But lights and sirens is usually a 1 or a 2. Everything else is a 3 or up. Does that make sense to the group?
Yeah.
Okay, so it's about $350 at my shop at Shands. Let's talk about how much that costs at a private for-profit hospital, and that's the next question. Cue the music.
So it's North Florida Regional Medical Center, Columbia HCA is the institution.
Correct. Thank you, Fred. Thank you for dancing with me, Steph. Did everybody get a chance to give an estimate? Again, it's not wrong. It's not cynical if it's accurate, right? So let's see where we're at. I'm trying to make sure that oh, there we go. There we go. Okay. So
I think the winner is Albert.
let me see. I'm going down, I'm going down, I'm going down. What did Albert say? How much?
3,000.
Oh, yeah, there it is. Yeah, 3,000.
What?
And what's the actual cost?
$5,000.
Yeah,
What?
That's
yeah. So
that's-
this is
outrageous.
a
outrageous.
go ahead, Fred.
Are you kidding me? A level 3?
Yeah,
Holy cow.
right. So this is the problem, right? And there was a Tampa Tribune article maybe in 2016 that I could reference talking about like HCA hospitals and these private hospitals about how much they charge for like trauma level activations, right? And the costs were astronomical compared to, for example, Jacksonville or UF or Tampa, right? And they were 2-3 times as much. And we decided, for example, at Chance, that we were not going to engage in that. We were not going to profit on people's misery. And that's a problem. That's an ethical question to ask. So $5,000 for a level 3. So you come in for abdominal pain, your kid comes in for abdominal pain, you might have appendicitis, you might not. You're still going to get charged $5,000. So I think what people have, I'm looking at these numbers, they're lower than the previous numbers because I think people blinked.
And I should point out in turquoise, we looked at, there are 4 other Columbia HCA hospitals in our area, and they were all between $4,000 and $5,000. So what they're doing, out of the 8 hospitals in our 50 miles within our zip code, 5 of the hospitals are actually colluding and charging these extremely high costs.
Correct. You know, and if I may editorialize a little bit, it's trickling down. So if you paid attention to, for example, what happened in the match, especially in emergency medicine, you know, long-term programs did not fill, but HCA took a huge hit. And now we know that the quality of care that they're providing is expensive, but the education that they're providing may not be what it should be. Moving on. And thank you for letting me do that. Fred, do you want to do Johns Hopkins or you want to move on to another question? Yeah, let's do Johns Hopkins. I'm curious. So now we have this.
Yeah, Maryland, 2 hospitals in Maryland, Johns Hopkins and 1 other. Yeah.
Yeah. So let's do that. So this is a premier institute in the country. Everybody knows Johns Hopkins, right? It's a respected institution for the same care that gets $5,000 at HCA, about 3 bills at UF. What do you think Johns Hopkins charge? Cue the music. Johns Hopkins, level 3 emergency medicine visit. All right, what do we got? Go on, guys. Ooh, again. 875. Julia, you're playing the odds. I like it. I like it. $3,000, $6,000, $1,000. Those are better answers. 4,001. Okay, this is not the Price is Right. You don't have to do that $1 thing. It's just $2,500, $5,000. So if it, again, I'm curious about the people who give these astronomical numbers. Like, where does that come from? Like, why did you write $5,000? Because that's important, right? Because this is what we're trying to get at. We're trying to reduce or address healthcare expenditures. And unless we know why you think it should be 10 grand, 25 grand, or whatever, we don't really have the data that I think we need to focus on the problem at hand. Would I be wrong to say that, Fred? Or Steph?
I agree. I suspect, and I'd like somebody to share their why they came up with that. Johns Hopkins is one of the finest medical centers in the world. And therefore, the assumption is if you're a higher quality, you would charge more. And that's the way most services work. But guess what? Not in healthcare.
No.
So
And
Matt,
John,
the problem we have is everybody went over.
yeah.
The price is
And-
$502.
And I think we got beguiled by Johns Hopkins, and isn't that the thing? Right?
John Krinsky, he did 520. That's close enough. We'll make him the winner.
John Krinsky wins.
Yeah.
It's just interesting that we have this cynical approach. You get that window envelope from your hospital, and you cringe when you open it up, and it's just not enough coverage for your healthcare, and it's way overpriced, and it's not regulated. It's whatever. Let's keep going, man. This is great, Fred, by the way. All right, let's do another hospital. Let's do Boston.
Well, let's do another one in Maryland. We had a little private hospital in Maryland.
Oh, okay. A private hospital in Maryland. Is that a for-profit hospital, Fred?
No.
So it's a public, not-for-profit community hospital.
It's called Holy Cross Hospital.
Yep,
So
Holy
it's
Cross.
religiously affiliated. It's religiously affiliated. And most of
And they
them
are
are not
totally-
for profit. Yeah.
And they are. Do you guys know what EMTALA is? So EMTALA is this Emergency Medicine Transfer and Labor Act that you have to see everybody that comes through the doors of your ED. Even if they're a zombie, you still have to take care of them. And a lot of these private hospitals struggle with that concept. The public hospitals don't. And Holy Cross is one of those hospitals. So the question is, again, what would you think the cost for a level 3 emergency medicine visit at a place like Holy Cross in Maryland, where is it? Baltimore.
And Matt, everybody, actually, well, yeah, we can't have the same winner twice.
Why not?
So what was the price? The price is, Matt, do you have the price there?
$332, Fred.
That's right.
And who got it right? Who nailed it?
Actually, no, for Holy Cross, it's let's see. I think it's It's 199. 199 for Holy Cross.
Oh, I got 332. Sorry, my bad.
That's 199. So actually everybody went over, even Stewart, he said 200. He missed by 10 cents. Or $1. Anyway, the next closest, we'll just have to change the rules here. Let's see, Albert has already won too, and he got it. He's the closest. The next closest is Vanessa at 411. So we'll declare Vanessa as the winner. Congratulations, Vanessa.
So I think an important point of this exercise too, by the way, because we're running out of scenarios, but I think an important point is that, we all stink at this, right? We all stink at estimating costs, right? We all stink at understanding like how much a blood draw is, or your analysis is going to cost, or just a simple physical exam, or a wellness check. Taking your kid, to get his immunizations. These are basic things that we're just terrible at. And we open up a can of worms every single time we do this. And, I've got a kid that has medical issues, and it's tough because every week the bills come every week. And I used to think about how do people fill their gas tank years ago, when gas is so expensive, and now a lot of people can't take.
Well, the problem, Matt, is it has no rational basis. That's the problem.
Well, that's exactly
No
right.
matter
I'd love
how
to hear other
logically you
people's
think
thoughts on
about it,
this.
it does not have a logical basis. And who knows? We have no idea what goes into deciding what they're going to publish as their charge, their cash charge. No idea. So let's go on to Boston, my favorite city, the Mecca for healthcare.
I noticed a theme, Fred, about what you picked.
Yeah.
Yeah. Boston. Boston's an expensive city, right? But it's a great city. And hold on, sorry. Okay, so we're gonna do the same scenario, but we're gonna do it in Boston. And we're just going up and down the East Coast. We're not even leaving the Mississippi River. So what do you think the same cost is for a level 3 charge in a city like Boston, Massachusetts, General? So remember who owns these hospitals, right? Who owns these hospitals, Fred?
That's affiliated with Harvard University. They're a separate.
But they're affiliated with
Mass
Harvard.
General and Brigham are an entity all to themselves.
Yeah, they're affiliated with Harvard.
They're nonprofit. They are nonprofit.
In the city of Boston, which is a great city, and let's go. Cue the music.
Okay.
Let's go, Jeff. Nailed it. Been off the whole time.
Okay. People are much more realistic this time.
They are. Wow. So this is the one time that with the cost, based on what Dr. Southwick sent me, is egregious. This is an egregious cost.
Why? You got the right thing. It's $865.
Oh, Jesus. Throw me under the bus. I got 4,100.
I don't know where you got it wrong script. I don't know what's going on. The price is $865.
Well, but I got the script you sent to me, brother.
Are you looking under the right procedure?
Yeah.
Level 3 ED.
We're on question 5 right now.
Right. Question 5. It's $865.
Oh, there you go. 865.
Yeah.
That's still expensive.
Yeah, let's see. So I think looks like I think
Thank you.
VCAS may have gotten that.
But
50.
Melissa,
Let's
Melissa's
see.
closer.
Who's closer?
Melissa.
Oh, okay. What'd she? Oh, 750. Melissa Gus. Melissa wins. Yep. Melissa wins. 750.
Yay.
Congratulations.
Undying love and affection.
I wanted a message on my answering machine, but that's all right.
Oh, okay.
Steph, are you putting a message on their answering machine?
I mean, I think Melissa gets to choose who leaves the message on her answering machine.
That's awesome. All right.
Okay, now it's Boston University Medical Center. They
Okay.
are also a nonprofit, and they are in the heart of the most indigent part of the city.
Yes, I've walked by there.
Yeah.
It is in a tough neighborhood.
Yeah, I trained there when it
Did
was
you really?
Boston City Hospital. Yeah.
Yeah,
So
it's
I
a
know it
tough
well.
neighborhood.
Yeah.
And
So
They
let's
take
start the
care-
music on this. So what is your estimate for their charge for this level 3 ER visit? Okay.
wow, look at Fred, look at that. It's like we're figuring stuff out. The prices are getting more.
And the actual price is $327. So who came closest to three? Oh my gosh. Angela killed it. 325.
Yeah, so
Yay!
You got it. Okay. You can't do better than that. That's the closest we've had anybody come.
yeah,
Right.
that's fantastic. Oh, she gets both showcases, by the way.
Yeah, that's a really good
Again, the variability, the randomness is just rampant. So you guys ready for a different scenario?
So now I want to share, we want to just take a little break, and I want to share a video, a TikTok video.
Oh, sorry.
Yeah, of a person who visited an ER and got 5 stitches. So let me share this video.
Do you want to know how bad healthcare is in America? Here's how bad it is. I get stitches, cut my finger the other day. Go into the hospital, get my stitches done. No big deal, whatever. I have to wait 2 weeks to get them taken out. In the meantime, I get billed for my visit. Before insurance, for 5 stitches, $3,800. After insurance, $1,800. Or $1,900, excuse me. After insurance, $1,900 for 5 stitches for a terrible hospital visit. Anyway, fast forward, so I get my bill and it's time to take the stitches out, so I schedule an appointment at the urgent care that is associated with the hospital that I went to, same company. So I schedule suture removal appointment online, and then I go in for the appointment and they say, sorry, we're not going to take those out. Since you got them done at the hospital, you have to get them removed at the hospital. I said, why didn't you tell me that when I scheduled the appointment online? They said, sorry, go to the hospital. So I go to the hospital. And then I wait around for a while in the ER, and then I get back and I ask the nurse, hey, this is what happened. They turned me away at urgent care, told me to come here, that you guys would do it for free. Is that true? And the nurse said, let me check on that. I'm going to check with billing really fast. So they go check on billing, and then they say, sorry, billing says that you'll have to pay to get these stitches removed. And I said, that really sucks because I paid $1,800 to have that done after insurance. And they said, that is absolutely ridiculous. And I said, I know. And then I said, gonna be honest, I'm not gonna pay any more money to the hospital because I already paid too much anyway. So I'm just gonna go. And I said, I think I might just remove them myself. And they said, that makes sense because that was so much money. So we'll just take you off triage. It'll be like you never here. Don't worry about it. And then they were like, you know what? Let me just don't tell anybody we gave you this. And they gave me a little kit to remove my stitches myself. So that's a little story about healthcare in America. $1,800 will get you 5 stitches, and then nurses have to go behind the backs of the hospital to get you treated. So that's pretty stupid.
Good, Matt. Okay, we can go now move on to the next group.
Yeah, so like, does anybody have any comments or thoughts about that video? Because that's painful to see. I can take out your stitches. All right, let's go.
I'm just proud to be a nurse.
Well, yeah, thank you so much.
It's true, Stuart. In my observation is the nurses get it. The nurses always get it. The doctors, for the most part, I got to confess, we're clueless. We don't know anything about charges. That's all. They're purposely keep us out of that. And in some ways, it's good because we don't make decisions based on cost or insurance coverage. But in another way, if we use too many tests and someone has a giant deductible, they can get clobbered. And we had no idea that they were going to suffer with that kind of charge. So it's a double-edged sword, and I don't know a good solution for it. But
no, but Fred, you hit the nail on the head. That we're kept clueless on purpose. So here's a simple question: you're an ID doctor, correct? I know you are. So the 900 milligram clindamycin tablets are very, very expensive. But the 150 milligram tablets are generic and super, super cheap. So you just have to take more tablets, but you can get the same dose. And that's something that we just don't teach people. Like, just give them a bunch of tablets. Yeah, sure, they may get a little diarrhea, but their MRSA is not going to come back. So it's these little things that we just don't instruct our students, our residents, our faculty on managing moving forward.
yeah, it would be ideal. What if everybody paid X number of dollars per year to get all the care that they needed, period? And then they wouldn't be charged anything. Wouldn't that be a lot easier?
Oh, well, 100%. So we're talking about like procedures and details and the mechanisms of healthcare, right? Like what that looks like. So this is a perfect segue to the next question that you posed, Fred, right?
Right.
So now we're going to get, so this is a common problem. Everybody knows, everybody's had back pain. Everybody's had trouble throwing their back out, doing something, do much yard work or whatever it is. So let's talk about getting an MRI of your back, your lower back, right? So you need an MRI of your lumbosacral area and to check for herniated discs and fractures. And this is very common. You see this, whoop, too soon. Hey, who's cut me off? You see this all the time. And you got a little bit of weakness, you got a little bit of foot drop, right? And you have an abnormal exam. So something's up. So let's go to North Florida and again, UF, and see what the cost is for these exams. Cue the music.
Okay, here it goes. Take your guesses. Okay.
How did you, Fred? Give me the tally.
Wow. Well, let's just do the cost at University of Florida is $974.
So
So-
Janice, she has access to the data and she cheated.
Who did?
Somebody wrote 925.
No, I don't think Janice knew. Yeah,
I'm kidding.
925. Janice wins.
Yeah.
Yeah, good. Very
Janice-
good guess.
I knew because I just had an MRI.
Oh, did
Ah,
you really now?
okay.
Of your
At
back?
UF? At UF?
I'm sorry?
Where was it? Where'd you have it? At University of Florida?
No, in Massachusetts.
Okay. Well, that was fortuitous. I guess the financial structure must be similar. Was it an academic medical center, non-for-profit?
Actually, the Brigham, I was in the trauma center. It
Okay, Brigham, okay.
was
yeah.
actually a year ago. Yeah.
Good, okay.
Good,
So,
yeah. So.
Yeah, well, I should mention that I had an MRI in Boston in September, and it was $7,000. I have the bill. I've shown it before.
That's,
and what
I'm sorry.
hospital
Dave,
was that?
that's-
What hospital was that?
It was Dana-Farber.
Do you know
Wow.
how much of it was the reading?
It's been more expensive. I only paid $925. I don't know what the insurance company paid.
The insurance company, well, mine is Medicare and it paid $450,
Right.
but the total bill was like $6,900.
But the good
Yeah.
news is they can't balance bill you for that, right? You didn't have to pay.
No,
it.
they won't. I mean, I'm on traditional Medicare, but it's, that's what MRIs are around here. I don't know how you got a cheap one,
Yeah.
Janice.
Yeah, I'm also on traditional Medicare.
Yeah, me too.
Okay, Matt, now it's Columbia HCA, North Florida, for-profit, same.
Okay, so the first one is at Shands, right? So
Right.
it's again, a not-for-profit hospital, air quotes. And now we're going to go to an HCA for-profit institution. We're going to ask the same question. You need a lower back MRI, right, of your lumbar sacral area, which is where we all hurt every single time when we do heavy lifting, deadlifting and stuff like that. Don't deadlift, it's bad for you. And same question, cue the music. Ooh. Ooh. Wow. So this is great. So a little low, a little high. But we got a $6,300 post. And Fred, what is the cost?
$6,137. Very close.
Very close, which is, I don't know, that's kind of expensive. And somebody got it. Somebody wrote $8,000, which is also,
Yeah, I think that's the best estimate. I think we should go with that. Although 5,000, Vanessa did 5,612. That was, she didn't go over. But Vanessa already won once, right?
But the Price is Right rules, man. You got to honor them.
But we decided we will only have one, everybody would win once.
Right,
Okay,
Vanessa's
fair
already
enough.
moving on to the final round. So if it's not Vanessa, then who comes next?
Next, let's see. Vanessa. See.
Deirdre,
Melissa
maybe?
went over.
Deirdre's 5,500.
Yeah, I think that's Deirdre, yours is, looks like it's the highest. Yeah, but without going over. Yep. Deirdre wins. Congratulations, Deirdre. Okay.
Way to nail it. Way to nail it. Okay, let's go to another institution. So we're going to go back to Johns Hopkins, right? Again, an esteemed medical center in the United States, right? One of the best places in the country. And we had the same study for lumbar sacral, lower back MRI, what's your estimate?
Okay.
Let's see where Fred.
And Johns Hopkins, their cost is 1,060. How do people do?
Jeez.
Everybody kick this over the goalpost a little bit too far.
Well, I see there's some as, sorry, boy.
I think Lena's
Angela
winning this
wins,
one.
but
Lena
it's-
looks like the
Oh,
best.
no.
Lena, yeah. That hasn't won yet. Lena hasn't won yet. I think Lena, I agree. Lena, I think you got it. Okay,
$900.
$900. Lena is the winner. Very good.
So we have time for one more question before we move on to the final round.
Steph, which one do you want to do?
Let's go on to question 11.
Fair enough. Fair enough. All right, we're going to Boston. We're getting some clam chowder. And we're going to Massachusetts General Hospital. Same study, MRI, lower back. What do you think the cost is? Yep.
Okay. And the cost is $4,149 they're charging.
Wow, Stuart did it.
Stewart already won once. Who else?
Got over.
Oh, wow. Stuart, $4,200. Man, nice. Stuck the landing.
Stuart was close.
Betsy looks like she was 4,000. I think that's the next closest, right? Anything closer than that?
No,
Good.
doesn't look like it.
Okay, so Betsy is the winner. Congratulations, Betsy. Okay, so now I want to play, what we'll do is I'll just play one short TikTok, and then we're going to go to the final, and then we're going to have, we shortened, we've got a total of 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 winners. So we want everybody to introduce themselves very briefly. But should we do that rather than do the video? What do you think?
Yeah,
Yeah,
let's
do
jump
that.
in.
I'd like to hear that,
Okay.
Fred.
Do
Yeah,
the
that's
Okay,
great.
video.
so the winners are, each of you, we just say a few words. Stuart, you were the first winner. So, where are you from and what do you do?
A nurse practitioner in Pittsburgh, Pennsylvania. And the reason I'm on the executive committee for RC. The reason I'm wearing this mask is not because I'm worried about COVID. I'm worried about patients over profits. And I'm trying to cut the smell of the University of Pittsburgh Medical Center, which is 5 miles away from me and has the highest fair share deficit of any hospital in the country. And it stinks.
Okay, the next winner was Albert. Albert, where are you from?
I'm from Bethesda, Maryland. I'm retired. I'm a friend of Leland. That says everything.
You're what? Excuse me, I missed that last part.
I'm a friend of Leela's.
Oh, good, Leela. Good recruiting, Leela. Excellent, excellent. And are you familiar with healthcare charges before this?
I was a medical service corps officer in the Army a long time ago.
Yeah, did these differences surprise you?
Very much, very much.
Okay.
Yeah. My question always is, what do they do with the difference?
I'm actually
Well,
gonna
not
meet
even
with our biller expert here at UF. They're being
They-
very friendly, but I don't know. I don't
They,
understand.
they pay their CEO with it, is what they do.
That's what they do with it. That's what
Okay,
they
the
do.
next winner was John Krinsky. John, introduce yourself.
I'm from Blacklick, Ohio, which is near Columbus. And I just got recently involved in the organization. The one thing that, excuse me, I think I want to just say is I'm somewhat involved in patient advocacy, but to me, it's trying to gain momentum here and trying to ask the people that aren't volunteers or members to join, get involved. We need to do something about this, and we need to do it collectively around the country. So reach out to friends, family, get them involved because it hits anybody in any stage of life.
You're here.
Thanks.
You're here. Great. Very, very well said, John. Vanessa.
I'm Vanessa, another Ohioan from Cleveland, and I'm in the EC, and I like to make healthcare better.
Great. And Melissa.
Hi, everyone. I'm from the great state of Wisconsin, in Madison. So family physician, geriatrician, and causing good trouble in healthcare reform for decades.
Excellent. And how did you hear about this event?
Oh, I've been a member of the RCA. I've been to when they had the meetings, used to have the meetings. So I've
oh, great. Good.
Yeah. So I'd like to, it's a little coasty, so I'd like to get some more Midwest
Absolutely. Yeah, we need more Midwesterners. We definitely do. Great. Okay, Angela.
Hello. Hello, all. I'm from Freeport, Illinois, and I'm retired from the workforce.
Great. And how'd you hear about this event?
I received an email, and so I said, oh, this sounds interesting. Let me see what it's all about. So I signed up.
Oh, great. Good for you. Yes.
Has it been worth it?
Yes, it was. As I learned a lot. I didn't realize how high these prices are for simple, little simple stuff. $6,000 for a CAT scan? Wow.
No, it's
that is ridiculous.
I agree. Excellent. Well, welcome, Angela. That's great. Janice.
Okay, I'm a retired nurse from Massachusetts. And I'm chair of the healthcare committee of the League of Women Voters of Massachusetts. And I also sit on the board of MassCare, and we're working to pass the Medicare for All bill in Massachusetts.
Excellent.
Nice.
Excellent. Janice, you're very active. Wow. We'd love to have you stay in touch with us, be part of our organization. You could teach us a lot. Very good. Wow, impressive. We need more nurses too. We really are looking for more nurses. Good.
Wow.
We do. We don't need more me. We need more Janice.
It was a good profession for me. About 60 years, I was a nurse.
Wow. Excellent. Excellent. And Deirdre.
Hi, I'm from Boston and recently retired geriatric social worker, and I've been working with Right Care for a long time. Started with insulin advocacy because I'm an insulin dependent diabetic and could barely afford my medication.
Wow.
Great. And Lena.
Hi, I'm Lena. I'm from Miami and I'm currently a student at the University of Florida.
Great. Yeah, you've just joined up. Yeah, I have a lot we need your help with, Lena. I emailed. Did you get my email? I sent you an email.
I'll check right now.
Yeah. Okay.
I'll check my email right now.
Yeah, that's all right. That's right.
Go Gators.
And finally, Betsy.
Retired ER doctor, Medical City, Denton, Texas. That's like 30 miles north of Dallas and Fort Worth.
Wow. So how'd you hear about this event?
Oh, I've known about the Loan Institute stuff for like 5 or 6 years. And I care about the inequalities in health care. And care about what we're doing to people
Right.
financially.
Excellent, excellent. Terrific. Well, welcome. Okay, so now, Matt, we're gonna have to determine the final winner. We have one more price estimate, right?
So that was also, by the way, that was the best part of the whole event, is getting to hear people's stories. And I wish we had more
Yeah.
time to do that with everybody. So we're gonna go back to our final round. It includes everybody that got, what, the top 10, Fred?
Yeah, the top 10, they are gonna estimate this one.
Okay, so you gotta estimate the cost of a cardiac ultrasound. So cardiac ultrasound, you know what ultrasound is? I put a probe on your heart. I look at its motion. I look at your contractions, how hard the squeezing and stuff like this. This takes seconds. It also looks at the valves, which I'm not that good at. The aorta, which is super, super important. And it's a very popular test. It's easy to do for a lot of things like a myocarditis, which is a heart infection, heart failure, heart attacks, if you have no symmetrical contractions. And you got to estimate what the charge is going to be from a leading cardiologist at Johns Hopkins. Like, this is a Johns Hopkins cardiologist.
Ultrasound.
You got this, teacher. Cardiac ultrasound.
And we want all 10 suggestions to ahead or less. Everybody entered? Okay. So the actual price is, let's see here. It is $2,218. By the way, UF Health Shands only charges $330, but Johns Hopkins, for some reason, charges $2,218. That's their published cost.
So it looks like Melissa is our official winner.
Wait, doesn't Dawn have-
Melissa.
Yay.
Yay.
is it Dawn? Wait.
Dawn has
Now,
2,200.
Steph, didn't you have a little gift certificate thing?
We do. Yeah. So Dawn came really, really, really close, but this was our final round. So Dawn
Okay.
gets the knowledge that he got it right. But Melissa's our official winner. So Melissa, you win a $25 Visa gift card that
Oh, my.
says Patients Over Profits on it. So you and I will be in touch. I'll get your address and send it to you. And Stuart, I want to ask you, can you put your mask back on? So all the other runners up win a mask like the one Stuart's modeling with us. So for all of our other 9 final contestants, I'll get your address and send you a mask just like this.
Stuart, that's great.
And like I
Gorgeous.
said, it will not protect you from COVID or anything else, but it does cut the smell of profits from healthcare.
Wear it
You
over.
can't have 95 under it.
So awesome. Now I want to pass it over to Carrie for our final.
Can I just say one thing? I wore this to the grocery store one Sunday morning, along with my Patients Not Over Profits t-shirt, and I ran into the CFO of our hospital system. She wasn't happy.
I got your back, Stuart. I got your back.
Okay. Gary, take it away.
All right, I'll just close this out real quick. Thank you all for participating, and thanks to Matt, our host. I hope everybody had some fun. If anybody wants to try this again with new cities and different procedures, please let us know. And I think people have realized that hospital prices are completely random. And because of those unpredictable prices, when you add in the variability and what insurance will cover, so many people, 100 million people in the US have medical debt. And if you or someone in your family hasn't been affected by medical debt yet, you probably will. And meanwhile, hospitals are making a profit off of patients' pain and suffering. Healthcare shouldn't be a privilege that only the wealthy can afford. We need a healthcare system where everyone can get the care they need without worrying about co-pays and deductibles, how to pay for healthcare if you lose your job or become self-employed. We need a universal system that makes it easy for everyone to see a doctor, for routine checkups to prevent illnesses, and where we're also addressing the root causes of chronic illness. And that's our goal as the Right Care Alliance. We got a long way to go to get there, and we need lots of people power to move us along. Big changes like the ones we have in mind require a mass movement. And we actually need all of you here tonight to join us, and I'll tell you how you can help. So this game tonight is part of our campaign against medical debt and high healthcare prices. And to continue this campaign, we're planning on-the-ground demonstrations, and we hope that we'll get some press, and those are going to happen near the end of April or in early May. So we invite you to join us to design and participate in these protests. So in Gainesville, we're planning a bill burning action at One Love Cafe on Friday, April 21st at 7:30 p.m. Who's going to be joining for the Gainesville action? And then in Boston, we're planning a march and medical bill burning on Saturday, May 13th in the Longwood medical area from 1:30 to 3:30 p.m. Everyone put a star emoji in the chat if you're planning to join us for the Boston or Gainesville actions. And then everyone, whether there's a protest near you or not, if you are not already involved in the Right Care Alliance, fill out the interest form that's in the chat right now. If you want to get involved in the Right Care Alliance, and someone will follow up with you. And then join us this Saturday on Zoom for a TikTok workshop from 11 to 12:30 Eastern Time. We'll guide you through creating a ready-to-share TikTok video about why medical debt is a crisis and what we can do about it. Thanks again for joining us, and hope to see you soon at one of our events.